Community Memorial Healthcare has earned a 5-star hospital rating, which is always reassuring when you're a patient. Registered nurse and Vice President of Quality and Risk, Maureen Archambault, is here to tell us what being ranked among the top 15% of hospitals nationwide means and what it means for their Ventura community. Welcome to Wise and Well, presented by Community Memorial Healthcare. I'm Maggie McKay. Thank you so much for being here, Maureen.
Thank you so much for the invitation, Maggie.
Absolutely. Congratulations on the incredible achievement of earning a 5-star rating from CMS and the 5-star rating and Outstanding Patient Experience Award from Healthgrades. Could you explain to our listeners what this recognition means for Community Memorial Hospital Ventura and how the ratings are conducted?
It's a significant achievement for a community hospital of our size. It really is a testament to the work that our employees and our medical staff do working all together, and especially working through the pandemic. These scores were achieved, this recognition was achieved using data that was collected during the pandemic time. So super proud of our staff. The CMS 5-star rating looks at 5 domains of care. One is mortality. So what is our mortality rate of our patients? The second is readmission rates. The third is safety of care, and we'll talk a little bit more about what is included in that. The fourth is patient experience, and as you mentioned, we are in the top 15% of hospitals in the country for outstanding patient experience, patient satisfaction. And we're incredibly grateful for our frontline staff because that's really them that is achieving that patient satisfaction on a daily, regular basis every day. And then lastly, it's timely and effective care.
That's impressive, Maureen. You know, of course, the past couple of years have been so demanding for healthcare workers, especially due to the pandemic, as you mentioned. How did your team manage to maintain such high quality care during that challenging time?
I think it really speaks to the culture that we have here, Maggie. Our staff, our physicians are incredibly collaborative. All of them are very, very focused on the quality of care that we have here and making sure that our patients are safe and that they are satisfied with the care that they provide. On a very, very regular basis, we meet together to look at our outcomes, we look at our processes, and we're all working together for that common goal. And most importantly, we want to support our medical staff and our employees to make sure that they feel safe and that they feel resilient. And that's all about keeping them from burnout, keeping them present, and keeping them satisfied in their jobs. And that was a big challenge, especially during the pandemic. So we did a lot of focus work around resilience and recovery, making sure that they felt psychologically safe and were able to speak up and felt supported by providing them with debriefs, peer counseling, peer groups, peer support groups, events where we would allow them to be social, coming together to celebrate certain things. We had a lot of activities all around resilience, making sure that our staff were safe.
That's got to be a huge challenge, but obviously from this rating, you rose to the challenge. Can you share some stories of collaboration and dedication that emerged from all levels of the organization to achieve these awards?
So let me give you an example. During the pandemic, we had patients on the ventilator that required proning or being placed on their stomachs that would allow them to have better oxygenation, better ventilation. Mm-hmm. It was really hard work. It's tough for our nursing staff to be able to position those patients correctly. So we would look for volunteers to come and help. Our very first volunteers was our chief executive officer and our chief operating officer, who gowned up, got their PAPRs on, got their N95s, their goggles, everything, and went in shoulder to shoulder with our nursing staff to really care for those patients. I think that's a testament to our culture, how much we really want to support our staff, our medical staff, and most importantly, our patients. And that's really how we get to be a 5-star organization. It really takes that kind of commitment and attention to detail.
That is amazing that the people that high up in responsibility would come in and help. That's awesome.
Yeah.
Data collection and analysis play a crucial role in quality improvement. So, how did your team use data to drive decision making during these years that led to the recognition?
Yeah, so we do that in several ways. Here in the quality department, there are several individuals who are dedicated to looking through medical records, looking for certain performance that we want to make sure that we are meeting all of those requirements. We also are required to submit our data electronically to CMS, and that comes again right out of our medical record. What is documented in there, it gets directly sent to our CMS. And then lastly, we have departments who collect data on a regular basis, whether it's manual or through an electronic process from the medical record. And we submit that to external registries that we participate in. Those are typically professional associations that gather data from across the country, such as, in our cardiac services department. And we submit that information to our registries, and then we're able to look how we benchmark with our peers on a very regular basis. That benchmarking and that data collection, we look at regularly to be sure that we are meeting our goals internally or meeting standards of practice that are set by those professional associations externally.
How should our community look at these ratings, and what does it mean for their care?
That's a really great question, Maggie. And we really like to encourage our patients and the community to look at those ratings when they're trying to decide where they want to obtain their health care. I think this really speaks to our commitment to be sure that we are exceeding professional association standards, that we attempt to provide the highest quality of care as measured by either CMS or measured by our professional associations that we have joined. And it really speaks to the commitment that we have to be sure that our patients are kept safe and satisfied in our organization. The measures that CMS uses and many of these other agencies that publicly report on our performance are very objective. And they make sure that all of the hospitals are placed in the same type of measurement categories so that it can remain objective. So I think when the public looks at the data and the measurements that are used to get us to 5-star, I think that they can be very confident that the measures are important and the measures are objective.
Well, it is such an achievement, and we're so happy to hear all about it and how a hospital gets an award like this. Thank you so much for being here with us to explain how it all works.
Thank you so much for the invitation.
Again, that's Maureen Archambault. And to find out more, please visit mycmh.org/news-articles/2023/July. If you found this podcast helpful, please share it on your social channels and check out the full podcast library for topics of interest to you. I'm Maggie McKay. This is Wise and Well, presented by Community Memorial Healthcare. Thank you for listening.